One of Australia's leading economists is urging the federal government to consider slugging unvaccinated people, in other words, charging unvaccinated people with higher Medicare fees to help prepare the budget and pay for the pandemic's ongoing toll on the healthcare system. Independent economist Saul Eslake said there are many cases in which people are required to pay more due to choices they make affecting others, and this should be applied to those who choose not to get the COVID-19 vaccine without an exception. We welcome Saul Eslake to the program this afternoon. We've called Saul. Hello, Saul. How are you?
Good, thank you, Brent, and thank you for having me on your show.
It's a pleasure. What's been the reaction from people that have spoken to you today to this story that's come out with what you've said?
Well, I've had some interesting fan mail through my website, often from people who don't have either the courtesy or the intestinal fortitude to put their real names to the messages they send, and when you try to reply to them, funny, the emails turn out not to be real.
Yes.
There's been some interesting commentary on Twitter. On the other hand, most of the comments on the article in the Fairfax papers where this was originally published seem to have been surprisingly supportive. So I guess, there's the spectrum of opinions about these things that you'd probably expect.
Why did you come out and say this? How do you've been doing this for a long, long time, so you've been thinking about this, no doubt, for a long, long time. Why did you come out and say it?
It wasn't a conscious decision to call for this policy change so much as something that came up in a conversation with a reporter from the Sydney Morning Herald and The Age. And let me be clear, I'm, first of all, not advocating that vaccination should be compulsory. I accept that people have the right to choose whether to be vaccinated or not, and I wouldn't query that. Right. Second, I'm not proposing a large amount of money, and in particular, I don't imagine that what I'm suggesting would make a material contribution to reducing the budget deficit or budget repair. It's not really with that in mind. Rather, what I'm trying to do is draw an analogy with the long-standing policy that was introduced, I think, by the Howard government, that people whose income is above a certain threshold, which at the moment is $90,000 for singles and $180,000 for families, who choose not to take out private health insurance, have to pay a Medicare levy surcharge of between 1 and 1.5% of their incomes. And the rationale for that policy that was introduced by the Howard government was that people who can afford to take out private health insurance but choose not to, bearing in mind it's not compulsory, are in effect choosing to place an additional burden on the publicly funded health system that's funded in part through the Medicare levy that we all pay and through our other taxes, and that it's appropriate that people who make that choice make an additional contribution to the cost of the health treatment that they expect to be provided through the public system. Now, in my view, and I'm not claiming to be a health or an epidemiological expert, but my sense is that the overwhelming evidence is that vaccines do significantly reduce the chance that if you catch COVID, you'll need to go to hospital and require expensive, intensive care. And again, I'm not suggesting someone who's unvaccinated shouldn't get the best care that's available. They should, of course. But they're making a choice by being unvaccinated that is likely to cost the rest of taxpayers who have chosen to be vaccinated more, and by analogy with the policy in relation to taking out private health insurance, I don't think it's unreasonable that they be asked to pay an additional Medicare levy, which could be, just 1/4 or 0.5% of their taxable income. But I think that's a reasonable request on the part of the overwhelming majority of people who have chosen to be vaccinated.
Do you see, if the government was to introduce this, it being a way to get the vaccine hesitant over the line to have their vaccines?
No, I don't think it would persuade anyone who has chosen not to be vaccinated to change their mind. I mean, I'm assuming that people who choose not to be vaccinated in the face of, what's been a fairly extended campaign and encouragement from governments, that people who've chosen not to be vaccinated have made a conscious decision not to be vaccinated, and that's within their rights. This is just simply saying that if you make that choice, knowing that, as you must, knowing that it's likely to expose you to a greater risk of needing hospital treatment at taxpayers' expense, that you should make some contribution in accordance with your income to the additional costs that you're expecting the rest of us to bear.
It looks like it may be about 5% of Australia that won't be double vaccinated. Have you done the figures? What does that add to the bottom line, 5%, if you do this?
Oh, well, it would depend on the incomes of those people. I mean, if most of them are people on very low incomes, then they probably wouldn't be paying much by way of a Medicare levy on their incomes. And so it's not really the point to raise a whole lot of additional money.
Right.
It's just simply to say that, in the same way that, for example, if you smoke, you make an additional contribution to revenue by paying what is quite high by international standards excise on tobacco products. If you drink alcohol, you pay excise on the alcoholic beverages that you consume. And if you choose not to take out private health insurance, despite the fact that you're earning at least $90,000 a year, you make an additional contribution to the healthcare costs that you expect other taxpayers to pay. And it's just along those lines. It's not intended as a revenue measure. It's not intended as a penalty. It's not intended as some kind of incentive to make people change their minds about a decision that I assume they've thought about.
I see the Treasurer has come out today and said the government rejects the idea of charging people more in Medicare if they fail to get vaccinated. It will be interesting to see what comes as a result of your article today, and I imagine the amount of people that you have spoken to in the last 12 hours.
Look, I'm not surprised the government has rejected it, even though the government, it was a coalition government that introduced the requirement about private health insurance. It was also a coalition government that introduced the no jab, no pay policy, whereby people who choose not to get their children vaccinated against a range of childhood diseases like mumps, rubella and measles don't get childcare subsidies. Indeed, it was the present Prime Minister who, when he was Social Services Minister, withdrew the conscientious objections provisions to that policy that were originally in there. But the coalition, I think, knows that most people who are opposed to vaccinations for COVID are supporters of the minor parties whose preferences the coalition needs in crucial seats if it's to win the next election. So the government's response doesn't surprise me. That doesn't mean to say I think it's right.
Exactly. Saul, I've got to go to the news. Thank you so much for making yourself available on what is a busy day for you.
Not at all. Thank you for having me.
Bye-bye. Economist Saul Eslake.